Welcome everyone to my presentation today. So this is my student ID card. Yep. So this is my lovely patient today. She came in hospital with stroke-related symptoms on the left side. So regarding her I2E assessment, her airway, she's maintaining her own airway. The airway should be monitored if she has decreased consciousness Glasgow Coma Scale GCS, which is 12 over 15. The patients with reduced consciousness have a high risk of airway obstruction, so the airway should be monitored. So she has high respiratory rate, shallow breaths, and low oxygen saturation might be a compensatory mechanism of the body. Therefore, she might need to take fast and shallow breaths to have more oxygen. Even though her oxygen saturation is on the borderline of normal range, the risk is hypoxic because patients having oxygen saturation lower than 95% and should be given supplemental oxygen. Although oxygen of ischemic brain is caused by embolic stroke, oxygen saturation should be monitored continuously and maintained above 94%. However, to avoid hyperoxia in patients with stroke, oxygen saturation should be maintained 96 to 98% with supplemental oxygen. Hyperoxia narrows down blood vessels and creates toxic radicals, worsening ischemic brain. Is unable for an adult with stroke to compensate for mild hypoxia. Thereby, non-invasive measures such as oxygen supplying masks should be monitored. Teresa is hypertensive, which is her blood pressure is 170 over 95, and it is hypertension because the healthy blood pressure is lower than 135 over 85 for both systolic and diastolic pressure. Patients with ischemic stroke have increased blood pressure to enhance the perfusion. Hypertension can cause embolic stroke, and hypertension is also a physiological response to maintain cerebral perfusion pressure during cerebral ischemic and when the intracranial pressure is elevated. They also mentioned that the hypertension in embolic stroke leads to recurrent stroke, dependency, and even death. Teresa is tachycardic, which is the the heart rate is 132. So because the normal range of heart rate is between 60 to 100 beats per minute, a medical history of atrial fibrillation, which is AF, might cause atrial tachycardia, because the AF causes the atrial tachycardia. Terrestrial level of consciousness is decreased. She is 12 over 15. So she's has unconsciousness. So unconsciousness is one of stroke-related symptoms due to the blockage in the cerebral artery, decreasing the level of blood flow to a critical low level. These authors, Campbell and Cartry, also stated that the decreased neuronal electrical function due to the blockage in the cerebral artery reduces the level of consciousness. The level of consciousness of patients with stroke should be monitored by using GCS to manage the trend of improvement or decline in the level of consciousness. Teresa is afebrile and she has IVC, which is intravenous cannula on the left keyboard fossa to be administer fluids. Patients with should be kept by mouth until a swallow screening is done or a completed swallow assessment by speech pathologist. Therefore, dehydration is common in stroke patients because they cannot eat or drink initially. Dehydration worsens the stroke by leading to hypotension, then hypoperfusion, and then subsequently to damage of ischemic brain region. To be hydrated, patients are given IV solutions with serum electrolytes. So I'm going to come up with some nurse interventions. So cerebral perfusion is one of the first priorities for patients with stroke. Intravenous thrombolysis is an applicable intervention to improve cerebral perfusion for patients with ischemic stroke, whether the large vessel is occluded or not. Thrombolytic therapy is used to dissolve clots by destroying fibrin, such as with medications like antiplase. This author, Johnson Barnes, also stated that this intervention should be performed less than 3 hours after stroke onset. This therapy aims at restoring cerebral perfusion, preventing for the cerebral ischemia and controlling the cerebral edema. Moreover, patients with this ischemic stroke should have their blood pressure below 180 over 110 before treatment and the first 24 hours after the treatment to be eligible for intravenous thrombolysis treatment. The blood pressure management should be considered as a high priority intervention as well. According to Considine and Anderson 2024, the hypertension in embolic stroke leads to recurrent stroke dependency and even death. Therefore, the first 48 hours after stroke onset, the blood pressure should be monitored closely. Next, neurological assessment should be used frequently to detect the progression or regression of neurological symptoms and make timely interventions. Regarding GCS, pupils' less reactivity and echo size indicate signs of the brain damage, increased intracranial pressure, or even more complicated neurological problem. These authors also stated that Hill and Michelle also stated that recovery or deterioration of the weakness and paralysis on one side of the body are also potentially monitored with GCS. Based on the stroke-related impairments, foreign risk assessment and intervention should be initiated. For patients with strokes, using bed railings to prevent patients with strokes from falling. Furthermore, for general fall prevention guidelines for the elderly can be applicable for patients with stroke, such as like in the picture you can see the crash mat on floor. I'm gonna come up next with some medications. So the first one, IV heparin. Heparin should be given via subcutaneous SC injection, intravenous IV therapy due to its effectiveness. So in this case, Cyrista will have IV heparin because it is used when oral and SC heparin is not clinically suitable. The IV heparin is individualized therapy because the dose rate, the duration of administration are based on the individual's weight, clinical condition, lab results, and medical history. Before commencing IV therapy, lab tests should be performed such as full blood count, prothrombin tone, activated partial thromboplastin tone, urea electrolytes, and creatinine should be done. Moreover, the actual body must be measured and the liver function test should be done. Formulation of the heparin must be checked thoroughly before administering medications. During the course of infusion, hematocrit and occult blood in the bloodstream and the stool test should be performed. The APTT blood test should be performed between 46 hours after commencing infusion with following rate change. Blood sample for APTT should be taken from the opposite limb to the infusion site. The major and common adverse effects are hemorrhage from organs and body systems, and some rare effects such as osteoporosis, allopathemia, ataxia, and thrombocytopenia. Those previous authors, Bullock and Mannes, also stated that patients should be advised to report any signs of bleeding, black stone, undisciplined bruising, and bruising gums, rejecting the IV heparin dose if there is minor bleeding, or ceasing the infusion if there is a major bleeding, and escalated major bleeding. Next one is the metoprolol. Metoprolol's maximum dose should not be more than 400 milligrams per day. Before commencing metoprolol, baseline assessment of heart rate and blood pressure should be performed. In addition to baseline assessment, baseline ECG and risk of heart failure should be taken into consideration. Metoprolol should be swallowed whole. Metoprolol should be administered with meals or after meals when it is immediate release formulation of metoprolol, and it can be administered with or without meals when it is an extended release formulation. Some major effects are bradycardia, dizziness, heart failure, hypotension, fatigue. Heart rate, blood pressure, and ECG should be monitored after administering to observe any side effects. Metoprolol should be seized slowly to avoid rebound cardiac excitations. Patients should be advised to report any signs of heart failure, such as shortness of breath, swollen extremities, and weight gain. Next one, and also the last one, pantoprazole. Pantoprazole should be given one tablet 40 milligrams daily. The tablet should be swallowed whole, not crushed or chewed. Pantoprazole can be taken with some water or juice on an empty stomach. Pantoprazole is well-tolerated medication with mild adverse effects such as sweating, headache, rash, GI upset. This medication is associated with high risk of Clostridium difficile infection, low vitamin B12 levels in the blood, high risk of osteoporosis-related fractures, and importantly, pantoprazole is a good choice to prevent severely high risk of GI bleeding from antiplatelet therapy. And that's it, the end of my presentation. Thanks for listening.